Question 1. A patient receiving chemotherapy reports sudden muscle cramps, nausea, and dark urine. Which condition should the nurse suspect first? A. Spinal cord compression. B. Tumor lysis syndrome. C. Neutropenic fever. D. Superior vena cava syndrome. Answer: B. Tumor lysis syndrome. Rationale: TLS develops when cancer cells break down rapidly, causing electrolyte imbalances with symptoms such as muscle cramps, nausea, and dark or decreased urine. A is incorrect because spinal cord compression causes back pain and neurological changes. C is incorrect because neutropenic fever presents with elevated temperature and infection signs, not electrolyte imbalance. D is incorrect because SVC syndrome causes facial swelling and venous congestion. Question 2. A neutropenic patient reports chills and a temperature of 38.3 degrees Celsius, 101 degrees Fahrenheit. What is the nurse's priority action? A. Administer antipyretics. B. Notify the oncologist immediately. C. Encourage oral fluids. D. Start cooling blankets. Answer: B. Notify the oncologist immediately. Rationale: neutropenic fever is an oncologic emergency requiring immediate provider notification and rapid IV antibiotics. A treats fever but delays life-saving care. C and D address comfort but do not treat the underlying life-threatening infection risk. Question 3. A patient receiving radiation to the neck reports painful swallowing. What should the nurse recommend first? A. Switch to soft, bland foods. B. Increase fiber intake. C. Use mouthwash with alcohol. D. Eat spicy foods to stimulate saliva. Answer: A. Switch to soft, bland foods. Rationale: radiation to the neck commonly causes mucositis and esophagitis. Soft or bland foods reduce irritation. B is not the priority. High-fiber foods can worsen discomfort. C is contraindicated because alcohol dries and irritates mucosa. D worsens pain and inflammation. Question 4. A patient on chemotherapy develops sudden back pain and leg weakness. What should the nurse do first? A. Encourage rest. B. Apply warm compresses. C. Perform a neurological assessment. D. Provide PRN analgesics. Answer: C. Perform a neurological assessment. Rationale: symptoms suggest spinal cord compression, requiring immediate neurological assessment to determine severity. A and B delay essential evaluation. D treats pain but does not address the underlying emergency. Question 5. A patient with metastatic lung cancer refuses further chemotherapy. What is the nurse's best response? A. Encourage them to reconsider. B. Explain that treatment can prolong life. C. Explore the patient's reasons and goals. D. Notify the family to discuss alternatives. Answer: C. Explore the patient's reasons and goals. Rationale: respect for autonomy and therapeutic communication require exploring the patient's reasoning. A and B impose pressure and are non-therapeutic. D breaches patient autonomy unless the patient requests family involvement. Question 6. A patient receiving cisplatin reports decreased urine output. What is the nurse's priority action? A. Document the findings. B. Increase oral fluid intake. C. Notify the healthcare provider. D. Continue monitoring for trends. Answer: C. Notify the healthcare provider. Rationale: cisplatin is nephrotoxic. Decreased urine output may indicate kidney injury. Immediate provider notification is required. A and D delay critical intervention. B may help hydration, but is unsafe without provider evaluation. Question 7. A patient receiving chemotherapy asks why they must avoid crowds. What is the nurse's best explanation? A. You may feel tired in crowded places. B. Crowds increase your risk for infection during neutropenia. C. Crowds can worsen nausea. D. It helps improve medication effectiveness. Answer: B. Crowds increase your risk for infection during neutropenia. Rationale: neutropenia increases infection risk. Avoiding crowds reduces exposure. A and C may occur, but are not the primary reason. D is incorrect and misleading. Question 8. A patient on chemotherapy develops mouth sores and difficulty eating. Which intervention is most appropriate? A. Use a soft toothbrush. B. Increase citrus intake. C. Use mouthwash with peroxide. D. Eat rough, textured foods. Answer. A. Use a soft toothbrush. Rationale. A soft toothbrush prevents trauma to the mucosa, reducing risk of bleeding and infection. B. Irritates sores. C. Dries and damages mucous membranes. D. Increases irritation. Question 9. A patient with lymphoma is receiving a new chemotherapy infusion and begins wheezing and develops hives. What should the nurse do first? A. Slow the infusion rate. B. Stop the infusion immediately. C. Document the reaction. D. Apply a cool compress. Answer. B. Stop the infusion immediately. Rationale. Signs indicate an infusion reaction. Stopping the infusion prevents further exposure. A is unsafe. C and D are appropriate later, but not first actions. Question 10. A patient with suspected superior vena cava syndrome presents with facial swelling and shortness of breath. What should the nurse anticipate? A. Positioning the patient flat. B. Preparing for emergency radiation. C. Restricting all fluids. D. Administering antipyretics. Answer. B. Preparing for emergency radiation. Rationale. SVC syndrome is an oncologic emergency often treated with urgent radiation to shrink the tumor compressing the vena cava. A worsened symptoms. The patient should be elevated. C is not indicated. D does not address the airway or circulation compromise. Question 11. A patient receiving high-dose chemotherapy presents with sudden confusion, twitching, and a phosphorus level of 7.0 milligrams per deciliter. Which action should the nurse take first? A. Administer phosphate binders. B. Place the patient on seizure precautions. C. Increase IV fluids. D. Notify the provider of possible tumor lysis syndrome. Answer. B. Place the patient on seizure precautions. Rationale. Severe hyperphosphatemia and neurological symptoms indicate imminent seizure risk. Seizure precautions protect the patient immediately. A and C are appropriate but not first. D is correct in diagnosis, but safety takes priority over communication. Question 12. A patient with acute leukemia develops a fever of 39.2 degrees Celsius, 102.6 degrees Fahrenheit, blood pressure of 86/48 millimeters of mercury, and an ANC of 150. What is the priority nursing action? A. Obtain a urine culture. B. Begin rapid IV antibiotic administration. C. Administer IV fluids. D. Notify the rapid response team. Answer. B. Begin rapid IV antibiotic administration. Rationale. Neutropenic sepsis requires immediate antibiotic administration within minutes, which saves lives. C is also important but comes after antibiotics. A delays treatment. D may be needed, but is second to administering antibiotics. Question 13. A patient receiving immunotherapy, PD-1 inhibitor, develops sudden dyspnea, dry cough, and decreased oxygen saturation. What complication should the nurse suspect? A. Immune-related pneumonitis. B. Pulmonary embolism. C. Pleural effusion. D. COPD exacerbation. Answer. A. Immune-related pneumonitis. Rationale. Immunotherapy causes inflammatory pneumonitis. B and C are possible, but typically produce different clinical patterns. D is unlikely without COPD history. Question 14. A patient with multiple myeloma reports severe back pain and decreased urine output. Labs show calcium 13.9 milligrams per deciliter. Which intervention is priority? A. Encourage oral fluids. B. Administer IV bisphosphonates. C. Strain urine for casts. D. Apply heat to the lower back. Answer. B. Administer IV bisphosphonates. Rationale. Severe hypercalcemia, 13.9, is life-threatening and requires rapid lowering of calcium via IV bisphosphonates. A is helpful but too slow. C is not priority. D. May worsen bone lesions. Question 15. A chemotherapy patient presents with uric acid 12 mg per deciliter, potassium 6.1 milliequivalent per liter, and peak T waves. What action is priority? A. Administer allopurinol. B. Prepare to administer calcium gluconate. C. Start loop diuretics. D. Notify oncology team. Answer. B. Prepare to administer calcium gluconate. Rationale. Peak T waves indicate immediate life-threatening hyperkalemia. Calcium gluconate stabilizes cardiac membranes. A and C help long-term, but do not fix acute cardiac instability. D delays emergency treatment. Question 16. A patient with a mediastinal tumor suddenly develops facial redness, distended neck veins, and difficulty lying flat. What is the nurse's priority action? A. Prepare for emergency MRI. B. Position patient in high Fowler's. C. Start IV corticosteroids. D. Assess blood pressure and heart rate. Answer. B. Position patient in high Fowler's. Rationale. Symptoms indicate SVC syndrome. Elevating HOB immediately reduces venous pressure and improves breathing. C and A are next steps. D is important, but not priority over airway relief. Question 17. A patient receiving high-dose radiation to the chest reports difficulty swallowing and chest pain when eating. What should the nurse suspect first? A. Acute esophagitis. B. Gastric ulcer. C. Myocardial infarction. D. Oral candidiasis. Answer. A. Acute esophagitis. Rationale. Chest radiation commonly causes esophagitis, presenting as painful swallowing. B and C don't match the radiation pattern. D affects the mouth, not chest. Question 18. A chemotherapy patient's lab results show WBC 0.6, platelets 18,000, and hemoglobin 7.2. Which intervention takes priority? A. Implement neutropenic isolation. B. Prepare for platelet transfusion. C. Administer packed RBCs. D. Monitor for shortness of breath. Answer. B. Prepare for platelet transfusion. Rationale. Platelets 18,000 indicate critical bleeding risk, making transfusion priority. A and C are important, but come after stabilizing bleeding risk. D is part of monitoring, not the priority action. Question 19. A patient on methotrexate develops mouth ulcers, rising creatinine, and confusion. What should the nurse anticipate administering? A. Filgrastim. B. Leucovorin rescue therapy. C. Potassium supplements. D. Sodium bicarbonate tablets. Answer. B. Leucovorin rescue therapy. Rationale. Leucovorin prevents toxic methotrexate buildup. A treats neutropenia, but not MTX toxicity. C. May worsen renal strain. D is used to alkalinize urine, but is not the immediate rescue agent. Question 20. A patient with lymphoma receiving rituximab experiences hypotension, fever, and rigors. What action is priority? A. Continue infusion at a slower rate. B. Stop infusion immediately. C. Administer acetaminophen. D. Notify pharmacy. Answer. B. Stop infusion immediately. Rationale. Symptoms indicate infusion reaction. Stopping infusion prevents worsening. A is unsafe. C is supportive, but not priority. D is not the first action. Question 21. A patient receiving CAR-T therapy develops confusion, expressive aphasia, and tremors. Which complication does the nurse suspect? A. Cytokine release syndrome. B. Immune effector cell associated neurotoxicity syndrome. C. Metastatic brain lesions. D. Sepsis. Answer. B. Immune effector cell associated neurotoxicity syndrome. Rationale. CAR-T therapy can cause icons characterized by aphasia, neurochanges, and tremors. A cause is fever or hypotension, not these neurological findings. C and D present differently. Question 22. A patient with leukemia develops severe right upper quadrant pain, ascites, and jaundice after chemotherapy. What complication is likely? A. Hepatic vein obstruction VOD. B. Cholecystitis. C. Pancreatitis. D. Hepatitis A infection. Answer: A. Hepatic vein obstruction VOD. Rationale: VOD occurs after chemotherapy or stem cell transplant. Symptoms include RUQ pain and jaundice. B, C, and D don't match timing or pathophysiology. Question 23. A bone marrow transplant patient develops a rash, diarrhea, and elevated liver enzymes. What is the nurse's priority suspicion? A. Sepsis. B. Graft versus host disease. C. Electrolyte imbalance. D. Allergic reaction. Answer: B. Graft versus host disease. Rationale: GVHD affects skin, GI tract, and liver. A and C may be possible, but do not present simultaneously with these hallmark symptoms. D does not involve multi-organ dysfunction. Question 24. A patient receiving doxorubicin reports dyspnea, new cough, and fatigue. What should the nurse suspect? A. Heart failure. B. Bacterial pneumonia. C. Pleural effusion. D. COPD exacerbation. Answer: A. Heart failure. Rationale: doxorubicin is cardiotoxic. Symptoms indicate cardiac decline. B and C have different patterns. D requires COPD history. Question 25. A patient receiving bleomycin develops shortness of breath and fine crackles. What should the nurse do first? A. Encourage coughing and deep breathing. B. Hold medication and notify provider. C. Administer bronchodilators. D. Apply humidified oxygen. Answer: B. Hold medication and notify provider. Rationale: bleomycin toxicity can cause fatal pulmonary fibrosis. Stopping the drug is urgent. A, C, and D do not address the underlying cause. Question 26. A patient with metastatic breast cancer develops new-onset, severe headache, blurred vision, and vomiting. What emergency should the nurse suspect? A. Brain metastasis with increased ICP. B. Dehydration. C. Migraine headache. D. Meningitis. Answer: A. Brain metastasis with increased ICP. Rationale: cancer metastasis can increase ICP. B does not cause neurological deficits. C lacks vomiting or vision changes. D includes fever or nuchal rigidity. Question 27. A patient receiving ifosfamide develops confusion, hallucinations, and irritability. Which medication should the nurse anticipate? A. Mesna. B. Methylene blue. C. Naloxone. D. Diphenhydramine. Answer: B. Methylene blue. Rationale: methylene blue treats ifosfamide-induced neurotoxicity. A prevents hemorrhagic cystitis, not neurosymptoms. C. Reverses opioids. D. Treats allergies. Question 28. A patient's labs show calcium 6.9 milligrams per deciliter, phosphorus 8.2 milligrams per deciliter, and tetany. Which emergency intervention is priority? A. Administer IV calcium gluconate. B. Increase dietary phosphorus. C. Provide vitamin D supplements. D. Encourage weight-bearing exercise. Answer: A. Administer IV calcium gluconate. Rationale: symptoms indicate acute hypocalcemia requiring IV calcium. Other interventions are non-emergent. Question 29. A patient with suspected spinal cord compression reports loss of bowel control. What action is priority? A. Administer PRN opioids. B. Prepare patient for immediate MRI. C. Assist patient to the commode. D. Elevate the head of the bed. Answer: B. Prepare patient for immediate MRI. Rationale: sudden bowel dysfunction indicates severe spinal cord compression requiring emergency imaging. A, C, and D do not address neurological decline. Question 30. A patient undergoing chemotherapy reports chest tightness and tingling around the mouth during oxaliplatin infusion. What is the nurse's priority action? A. Stop the infusion immediately. B. Encourage slow, deep breathing. C. Apply warm blankets. D. Reassure the patient. Answer: A. Stop the infusion immediately. Rationale: symptoms indicate acute hypersensitivity reaction, requiring immediate infusion stop. B, C, and D delay emergency action. Question 31. You are triaging 4 oncology patients. Which patient should the nurse assess first? A. A patient with colon cancer reporting severe fatigue after chemotherapy. B. A patient with AML who has an oral temperature of 38.5 degrees Celsius, 101.3 degrees Fahrenheit. C. A patient with lymphoma reporting new facial swelling and difficulty breathing when lying flat. D. A patient with breast cancer reporting 8 out of 10 postoperative incisional pain. Answer. C. A patient with lymphoma reporting new facial swelling and difficulty breathing when lying flat. Rationale. This presentation suggests superior vena cava syndrome, a rapidly progressive oncologic emergency affecting airway and circulation. B is urgent due to neutropenic fever, but not immediately life-threatening. A and D are non-emergent. Question 32. A patient with metastatic lung cancer refuses further chemotherapy despite family objections. What is the nurse's priority action? A. Encourage the patient to reconsider treatment. B. Ask the provider to speak privately with the family. C. Support the patient's autonomous decision. D. Arrange for an ethics committee meeting. Answer. C. Support the patient's autonomous decision. Rationale. Autonomy is the highest principle in oncology ethics when the patient is competent. A creates coercion. B may help but does not prioritize patient autonomy. D is not needed unless conflict persists. Question 33. A patient receiving high-dose cisplatin develops sudden decreased urine output, rising creatinine, and tinnitus. What is the nurse's highest priority? A. Notify the oncology provider immediately. B. Administer scheduled IV fluids. C. Prepare the patient for hemodialysis. D. Hold the next cisplatin dose. Answer. A. Notify the oncology provider immediately. Rationale. Cisplatin nephrotoxicity plus ototoxicity requires immediate provider notification to stop therapy and initiate emergency interventions. D will occur but requires provider orders. B may help but is not priority. C is not indicated yet. Question 34. A patient with newly diagnosed leukemia requires blood transfusion, but their cultural beliefs prohibit receiving blood products. What is the nurse's priority response? A. Request that the family convince the patient otherwise. B. Respect the patient's beliefs and notify the provider. C. Explain the consequences of refusing blood. D. Contact the hospital ethics committee. Answer. B. Respect the patient's beliefs and notify the provider. Rationale. Ethical nursing practice respects autonomy and cultural beliefs. C may be part of informed consent, but must not pressure the patient. A is coercive. D is secondary. Question 35. A patient develops sudden hematuria, flank pain, and hypotension after starting high-dose cyclophosphamide. What is the nurse's priority intervention? A. Encourage oral hydration. B. Administer Mesna as prescribed. C. Apply warm compresses to the flank. D. Notify the provider about suspected renal colic. Answer. B. Administer Mesna as prescribed. Rationale. Mesna prevents hemorrhagic cystitis caused by cyclophosphamide. A is supportive but not enough. C is inappropriate. D delays essential treatment. Question 36. You are caring for 4 oncology patients. Which situation requires the most immediate nursing intervention? A. A patient with neutropenia whose visitor brought fresh flowers. B. A patient with melanoma receiving immunotherapy who has new severe diarrhea. C. A patient with ovarian cancer experiencing mild abdominal distension. D. A patient with multiple myeloma who has chronic bone pain. Answer. B. A patient with melanoma receiving immunotherapy who has new severe diarrhea. Rationale. Severe diarrhea may indicate immune-mediated colitis, a life-threatening toxicity requiring high-dose steroids. A is concerning but not emergent. C and D are expected findings. Question 37. A patient receiving high-dose methotrexate begins showing signs of confusion and slurred speech. Labs are pending. What is the nurse's priority action? A. Increase IV fluid rate. B. Prepare to administer leucovorin rescue. C. Notify the family. D. Sit the patient upright to prevent aspiration. Answer. B. Prepare to administer leucovorin rescue. Rationale. Neurologic changes indicate MTX toxicity, requiring immediate leucovorin rescue to prevent permanent damage. A is supportive, but not priority. C is inappropriate. D is not the solution to toxicity. Question 38. A patient with tumor lysis syndrome develops hyperkalemia equals 7.0 milliequivalent per liter, phosphorus 9.2 milligrams per deciliter, uric acid 13 milligrams per deciliter, and wide QRS complexes on ECG. What is the nurse's immediate priority? A. Administer sodium polystyrene sulfonate. B. Prepare for emergency dialysis. C. Encourage oral fluids. D. Monitor hourly ECG. Answer. B. Prepare for emergency dialysis. Rationale. Life-threatening metabolic derangements with ECG changes require urgent dialysis. A works slowly. C is inadequate. D does not correct the emergency. Question 39. A patient with metastatic prostate cancer reports sudden inability to urinate, leg weakness, and numbness. What is the nurse's priority action? A. Insert a urinary catheter. B. Prepare for immediate MRI. C. Give PRN analgesics. D. Perform a bladder scan. Answer. B. Prepare for immediate MRI. Rationale. Symptoms indicate spinal cord compression, an oncologic emergency requiring emergent imaging. A and D delay diagnosis. C does not address the cause. Question 40. A bone marrow transplant patient is 16 days post-transplant and develops persistent fever unresponsive to antibiotics, rash on palms and soles, and bilirubin 4.3 milligrams per deciliter. What should the nurse suspect? A. Acute graft-versus-host disease. B. Hepatitis B infection. C. Drug reaction to antibiotics. D. Viral exanthem. Answer. A. Acute graft-versus-host disease. Rationale. GVHD is common 10 to 30 days post-transplant and presents with rash, liver dysfunction, and refractory fever. B, C, and D do not match timing or multi-organ involvement. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.